Good afternoon, everyone, and thank you for joining us today on Facebook Live. Today, we are going over probably one of my most favorite topics ever, misinformation, how to spot it, how to stop it, all of that. And today, we are joined with several local journalists and health communicators in our community, and they're going to go over all these tips and just kind of explain their process when they are reporting on health in general, but especially this COVID-19 pandemic. So before we get started, I will say if you have any questions, please comment them. I'll be watching on my phone so we can go over those at the end. And then we are going to kick it off by having each person introduce themselves. So Natalie, if you'd like to go first.
Hi, I am Natalie Hampton, and I am currently a policy coordinator at Missouri After School Network. But I'm here because previously I was the director or interim director of the Health Communication Research Center at the University of Missouri. And we worked a lot with the state, Department of Health and Senior Services, and other groups to build health campaigns that would have messages that were effective in influencing behavior change and policy change.
And Anna?
Yeah, my name is Anna Bruggeman. I'm a freelance journalist who's been covering the COVID-19 pandemic for the Columbia Daily Tribune. Today I'm speaking as an individual journalist. I don't speak for the Tribune, but I also researched audience trust during my undergrad and continued that research post-grad. Have worked in the media literacy field, which teaches people how to be better news consumers. And so I'll be speaking from those dual perspectives.
Awesome. And Sarah?
Hi, I'm Sarah Shipley-Hiles. I'm an associate professor at the School of Journalism at the University of Missouri, and I specialize in science, health, and environmental journalism. And I have a real interest also in misinformation and disinformation campaigns on everything from climate change to now COVID-19. So I'm really happy to be here talking about this today.
Awesome. And Sebastian?
Hey, my name is Sebastian Martinez Valdivia. I'm a public health reporter with KBIA and Kaiser Health News. And I have, like Anna, been covering COVID-19 here in mid-Missouri since the start, since back in March. So seen a lot of misinformation and a lot of changing information as well over that time.
Yeah, and for those of you who are joining us for the first time today, I'm Ashton Day. I'm a health educator here at the health department. I actually do have a background in journalism, which is kind of how I know a few of those people that are joining us today. While working in journalism, I saw a lot of the misinformation, and that's what inspired me to go into health educating and go to grad school for public health. But now that I'm here, I'm kind of trying to use all my skills and help everybody out in the community. So thank you all for joining us today. So let's get into kind of some of the patterns and things you all have seen during the COVID-19 pandemic. So what have you noticed about misinformation during the pandemic? And is it different than any other pandemic or health issue that you have covered in the past? And I'll kind of call on each of you. So Anna, if you'd like to start.
I would love to start. I think for me, it really just highlights the different kinds of literacy there are, as far as I talk about media literacy a lot, but there's also scientific literacy, and this goes for journalists as well. But I think I feel like we're all back in like 8th grade learning about the empiric method, but we're experiencing it like live and in person. And like the thing about the empiric method is it's really arduous. And you might learn something and then you go back and you can't replicate it and it wasn't really true and you might change your mind. But in real life, that really feels like you're being kind of lied to some extent, but that's really how the method works. And so as I'm reading a lot of the comments, we say a lot in journalism, don't read the comments, but I do. And what I see a lot from people is really just kind of confusion and a perceived betrayal of trust. And from a trust perspective, I always think of the ways that we can explain a process and the degree that we can explain this thing that is happening around us. But that's just kind of one of the major trends that I've seen since March and continuing now.
Yeah, Sebastian, do you want to build on that?
Yeah, I think that the fact that this is a novel virus, so it's new to science, has been a really big factor, especially when it comes to medicine. We're really used to going to the doctor and having them more or less explain what's going on and know how to remedy it. because doctors are super knowledgeable people. But this is something that very few people have knowledge about because it's new to science. And so with that, you're learning new best practices every couple of weeks. And as journalists trying to communicate that, and as public health officials trying to communicate that, that's really difficult because people want to hear clear, concise instructions. And when those instructions have to change because we've learned something new about the virus, it's really difficult to communicate that and explain it to people in a way that maintains trust and gets them to actually practice those best practices as well to keep themselves and their communities safe.
Yeah, Sarah?
Yeah, I think some ways that it's similar to other issues is like, for example, with climate change, we saw that become a very politicized issue where a lot of Republicans had concerns that they thought maybe climate change wasn't happening or wasn't caused by human behavior, and Democrats were kind of the opposite because political parties took those positions. And early on with the coronavirus, you did not see it politicized initially as much as it then became politicized. So I think it's very hard for people when they identify with a political leader or a political party to kind of go against, what those parties or leaders might say. It creates sort of a cognitive dissonance for people. How could I, believe this if my, elected leader is telling me something else? And so I think it's really important for people to understand that that sort of mental resistance does occur, and to sort of look outside of your own group that you're affiliated with and see if you can understand what the actual science is saying.
Yeah, Natalie, you come from a different perspective. You're not necessarily reporting every day, but you are watching how people react to that health news. So what have you seen?
So, and I used to work in politics back in the day and then worked in public health after that. So I kind of come from that perspective. And I don't know in terms of what necessarily different, but more pronounced is how afraid people are right now. And fear is very closely linked to anger. And fear makes people feel vulnerable, and it's very, very uncomfortable. So we see a lot of people who may actually subconsciously feel fear but are reacting in anger. And to illustrate that, I worked with the health department recently to do some interviews of people who were and were not wearing masks. And thank you to Hy-Vee and Connolly Walmart managers for letting us do those interviews. So we talked to about 36 people over a couple of days, and I asked them why they were wearing a mask or what would make them more willing to wear a mask if they weren't. And one of the messages that we thought would be effective is, would you, if you knew that it would help protect frontline workers, would you be more willing to wear a mask? But what I found is a lot of the people who were the most angry, they were themselves frontline workers. And my theory is that what happened is that they had to go to work. They were, a lot of them, low income, and they didn't have any choice. So they felt very fearful about going to work. And subconsciously, it's much easier to switch that over to anger, to say, I'm very angry at the people that are making such a big deal about this. And they're really the ones that are causing the problem. And that's just a much more comfortable emotion, and it makes people very susceptible to misinformation. So sometimes it's about helping people get into a safer, like where they feel safer and they can be more vulnerable.
Yeah, and in a little bit, we'll go over some tips on how to communicate with those people who might not believe some of the information that's out there. But first, I want to go over just kind of like the basics of figuring out if something is misinformation, if it's not true. So what are some tips to make sure what you're reading, what you're hearing is from a credible source? We use that term a lot, credible source, but how do you know if it's a credible source? Sebastian, we'll start with you.
Yeah, so there's a lot of factors that go into that in terms of like whether a source is reputable, and I know some of our other panelists are going to talk about some of those things. But going off of what I was talking about before, with this being a novel virus and with new information coming out constantly, one thing that's really important that I think gets overlooked a lot of the time on social media is checking the publish date of the story that you're looking at, because all stories will have that publish date right next to the byline, right at the top of the story. And with social media, something could go viral a month or 2 months after it's published. And that information could be completely outdated and no longer relevant and no longer best practices. So that's something to really watch out for. If you see a story shared on your Facebook feed or on Twitter or wherever, and you click through it and you're reading it, make sure that you check that publish date and check if there are any updates on that information, because a lot of the time with this specific subject, there will be.
That's a great point. And we saw that even with masks, the recommendations did change from the CDC, and there were new studies being published that were specifically about this virus that we didn't necessarily have before. So some of those things that were published, even in February, are not accurate anymore. And that can be kind of confusing. Sarah, what are some tips you have?
Now I'm unmuted. One fundamental thing for people to do is to look at the URL, the website of where the information is coming from. Sometimes with deliberate disinformation, there are actually kind of spoofing sites that will try to pretend like they're a mainstream organization, but they've changed a little bit of the website so that people don't realize it right away. So it's important just to look at that URL and then to do a little bit of investigation. Most web pages of legitimate organizations are going to have an about section, and that about section will explain, who is this organization, where are they based, what is their specialty, what kind of work do they do. So it's really important to understand the source of the information. And then ideally, you're going to be looking at an article that is from an actual trained health journalist. And there are many good resources for that journalists can rely on, like the Association for Healthcare Journalists, to get that training so that they have some expertise. But looking at the bio of the person who wrote the article, as well as the organization itself, would be a good idea.
Yeah, and Anna, what tips do you have?
Yeah, I always encourage people to follow the links. There's lots of hyperlinks in stories, and especially when it comes to data. If somebody cites a specific number, oftentimes a credible journalist is either going to state the specific organization that they got that number from, or they will hyperlink to the primary source of the data. When I say primary source, I mean like a database or a study. And what you want to be skeptical of, and this goes beyond health journalism and data, but what you want to be skeptical of is when you click on a link and it takes you to just another article that reiterates that point, because that's how things just kind of lily pad across the internet with not a lot of verification. And I think somebody else is going to get to it, but all caps and excessive punctuation in headlines is just bad news bears.
Yeah, thank you. And Natalie, what are some tips you have?
Those are great tips. I'm definitely going to make note of them. I think just stepping back, that it's so important that we're asking the right person. And so I'm not going to take my car to my doctor and ask her to fix it. I'm not going to ask my attorney for advice about farming. I'm going to take my car to A to Z Auto, and I'm going to call my Uncle Alan and ask him. So looking to see if the source is a public health professional or an infectious disease expert. Those are two really good experts for this. And sometimes we run into this issue of people don't understand there are different kinds of doctors. So someone may call themselves a doctor who isn't like an MD or an infectious disease expert. So helping people understand that is important.
Yeah, thank you. And we will take all these tips that you all have shared and turn them into an easy graphic for people to share. And we'll put that on our Facebook. So if you all are watching this and you want to share these tips with your friends and family, we'll have that available for you as well. So when we talk about looking at the source and knowing what a trustworthy source is, let's give some examples of some of those sources for people. Because I think with the internet, there are so many different places to find your information. So how do you know that something you're following is credible? So Sarah, I'll start with you.
Okay, great. Well, my suggestion to people would be to look at both national and local news sources. And in Columbia, of course, at the journalism school, I'm going to recommend our publications at KBIA, where Sebastian works. I work with Vox Magazine. We have the Columbia Missourian and KOMU. as well as the Columbia Tribune, I think are all really great sources of local news and information. And then I would also suggest that people look for reliable national sources that you can kind of follow on a regular basis, because there is so much new news, as has been mentioned, on this coming out. So a couple of really great places I would suggest would be Science News. It's a specialty publication where you can find a reporter named Tina Hessman-Saey, S-A-E-Y. She's an old friend of mine, and she just does such an amazing job of breaking down these issues in a way that people can understand. And there's another publication called Science Magazine, where you can find a journalist named John Cohen, who also does a really good job, and he gets into some of the nitty-gritty details on some of the issues that people are going to want to find out about. And then, of course, I would recommend looking directly at public health departments like the local health department, or nationally the Centers for Disease Control, and looking at their websites too.
Yeah. Anna, do you have something to add to that?
Yeah, and I think before I piggyback off Sarah, I really like when I taught media literacy to high schoolers, the first thing I did was really try to like divorce the fake news, whatever your definition of that, from journalism. And I would define fake news as an enterprise that endeavors to sell information, unverified information, for the sole purpose of money. Like, that is fake news. Journalism is a process done by reporters who are trained in ethics and follow an editorial process. And those are two like really granular definitions, but the ways an ethical process manifest in reporting are identifiable. If somebody is citing multiple sources in an article, that's a manifestation of an ethical principle called seek truth and report it. If somebody explains the process by which they made a piece of journalism, that's a manifestation of an ethical principle called be accountable and transparent. And so there are all these ways that you can identify Society for Professional Journalists. If anybody watching wants to get really granular, they can look at that, their ethical code. But like journalists who are trained in journalism take great pains to really go out of their way to both serve their purpose of reporting truth in the proper context. We're not scribes. But also to minimize harm. And sometimes people will be hurt by the things that we report, but we want to do that in a really responsible way. And so I would just encourage people to look into that process. I'm not going to get super into it because I could, but I won't. The other thing I wanted to add to having both local and national sources, I always talk about news consumption as if it's like a diet. And in the same way that you would not consume McDonald's or brownies for every meal, right? These hyper processed foods, you should not consume hyper processed information at all times. And so when I say hyper processed information, I mean like national broadcast network news. Like, if that is the only thing you are consuming, then it's like having McDonald's for every meal and wondering why your stomach hurts. That the foundation of your media diet should be those local providers, KBIA, the Columbia Tribune, Columbia Missourian, KOMU, and then you should kind of scale up look regional. So KC Star, St. Louis Post-Dispatch, and even regional national. If you're wondering about the outbreak in Oklahoma, look at the Tulsa World. That the New York Times is great data tracking, and they're awesome. But like, if you want to know what it feels like, what it looks like, how that community is dealing with it, a local journalist is going to be able to tell you that. And if they require a subscription, you can follow an individual journalist for free on Twitter, and I'm sure they'll fill you in. Sebastian is like king of the Twitter threads. I'm constantly jealous of his ability to write a Twitter thread. And then like continue scaling up. Look at national NPR stations, and at the very top of your pyramid, there should be network broadcast television. And I mean that at any network broadcast television. Okay.
Thank you. And Natalie, what would you like to add to that?
So first, I will say that I'm not a journalist, and I have gotten to, I'll do a little testimonial, work around journalists for the last few years of my life. And I think that they're really misrepresented. And these are really hardworking people. They don't make much money. So there's not a lot of reason for them to cause havoc, because they're doing this because they care about it. And they're kind of like public health people. They're not in it for the money. It's because they care about people. So the other thing I think that happens is, I'm sure that Anna knows the right name for this, but I call it kind of the murder phenomenon. So we hear about a murder and it's a really big deal and it takes a big space in our minds. And so people always think that murders are going way, way up. They have a little bit lately, but over the past decades, they've been actually been going down. Nobody believes that when I say that, because they hear about a murder. So you may have heard a story, or someone you love may have heard a bad story about the New York Times, because there have been times, I'm using that as an example, there have been times when there was something that went wrong and a reporter made something up or had a source that wasn't real. The reason you heard about it is because it was so unusual. It's a really good news source. If you compare that to something like the Inquirer, nobody's going to make a fuss if the Inquirer has something made up or gets something wrong, but it doesn't mean the Inquirer is a better news source than the New York Times. That's actually absolutely the opposite.
Right, thank you. And Sebastian, is there anything you'd like to add?
Yeah, just kind of going off of what Anna was talking about. If you see something on like network TV news, it's very rare that they're the first people to report it. The vast majority of time, it's a local reporter who's gotten that story out. Someone at a national desk has seen it and thought it was interesting. And then they reprocess it for national consumption. So they remove a lot of the details. They make it more potentially sensational or more eye-catching. And so you don't get a complete picture of what's actually going on. So the best thing to do, if you see a story on national news that piques your interest, like Anna said, find where that story is coming from and then find the local reporters covering it, because they're going to have a lot more detail, a lot more nuance than that national source. Also, the only other thing I wanted to touch on in terms of what makes something a reputable source, a lot of the time outlets, newspapers, TV channels, radio stations, they develop a reputation over the years because they have a strong editorial process. So there's a lot of people looking at information to confirm it and to make sure it's being communicated accurately before it goes out. If you're just looking at one person with a YouTube channel putting out information, there's none of those checks. And so a lot of that information is probably not going to be as reliable or as good as when you have a lot of people in an organization looking over information, double checking it, and making sure that it's correct.
Right, absolutely. And then so 3 of you are either reporting regularly or teaching those who do report in our community. So let's kind of get into what the experience is like for the journalist and how they confirm and verify the information that they get. And I'll start with Sarah.
Okay. So for journalists, there's often a big learning curve to start to cover a science, health, or environmental topic. If you don't have any training or background in that, there's going to be a bit of work for you to kind of get up to speed, especially on something as technical and as quickly evolving as this. So one of the ways that journalists who are new to the beat can learn about that is to subscribe to several things. You should probably join membership organizations like the Society of Environmental Journalists or the Association of Healthcare Journalists, where you can get lots of training and resources and how to cover these topics, and also to learn about the pitfalls that some of the other journalists have experienced, and you can benefit from some of their struggles and not repeat some of those same mistakes. And also there are various services that you can sign up for as a journalist, where you can get alerted to either new news that's coming out to make sure that you are constantly aware of the most recent science and the most recent issues that you need to be aware of, as well as new journal articles. So there's a constant release of new science, and that can be a bit overwhelming. So signing up for some of these services can be very helpful to help you stay informed as a journalist, so that you can then turn around and give your audience all that context.
And Sebastian, what's your process for verifying information?
Yeah, so it's a lot of cross-checking. It's a lot of making sure you get a wide variety of sources and you talk to a lot of people. If you get a bit of information from a source, you should try to figure out where they got that information and make sure that it's not just hearsay that you're communicating. And then the other thing that journalists do, ideally, that good journalists do, is that you approach everything with skepticism. So like Anna said, we're not scribes, we're not court stenographers. We're not just taking what governor or city council person is telling us and just publishing it without adding any information. We try to see if what they're saying is true. We try to add context to it. And we're skeptical. And that doesn't just apply to what politicians say, but like for studies, for example, there's been a huge proliferation of research about COVID-19. And so when we're approaching studies, we look at what was their sample size? Was this peer reviewed? Who's looked at this? And so that's, I think, a point that's really important to get out to people in the general public is that when journalists are reporting something, it's with that degree of skepticism. We've done that research and we've interrogated it. We're not just transmitting information. Ideally, sometimes this happens and that's bad journalism. But in the best case scenario, what we're trying to do is add context and question information that we get before we report it.
Absolutely. And I joke that skepticism is like a personality trait of journalists, because even though I'm not working in news anymore, I still, anytime I see anything, I'm like, okay, well, where did that come from though? And the CDC will update something and I'll go through all of their studies that they link, and just always, it sticks with you. That's for sure. Anna, what would you like to add about your process?
Yeah, I mean, yeah, skepticism is like a total brainworm. It's just stuck in there now. But yeah, I mean, to bounce off what Sebastian said, of just like, I wrote this story, I think it was May or June, about the historical precedent for systemic change in healthcare after a pandemic, which is like one of the wonkiest things I've ever pitched. I'm really thankful that my editor even gave that lip service. It's like, what a weird thing. But the University of Missouri has a medical historian who specializes in social change after pandemics and amid pandemics. But I didn't just talk to her. I talked to a hospital CEO. I talked to a nurse practitioner who operates out of Holden, a really rural community. I talked to a rural state rep. I talked to the hospital association, the nurses association, because I had, after what she had said, I had this kind of inkling of how this all connected. And I think like 3 or 4 of those people, I didn't even have space to quote. But I just wanted to make sure I was right, or as right as I knew, or as right as possible. We are people, we're not news robots. And so in the spirit of not being news robots, sometimes we might write something from that's colored from our own perspective, but I think that's valuable. I think there's no such thing as like blank slate journalism. It doesn't exist. And as much as we can bring all this experience, like, I'm not going to speak for myself, everybody else in this panel is like highly qualified. I would want to know their perception of all of this information. And so in the sense that we're not scribes, but we also are just like highly self-interrogating people. We're to the extent that skepticism is a brainworm, we're even skeptical of our own perceptions, and we have those skills of self-interrogation. And I reported that story for 2 or 3 weeks. And so it's not just like we have an idea, we find a person, we write a story. It's a really long process of verification and self-interrogation. But like, I don't know if audiences need to know that. It's not super interesting. I don't know how my toilet gets fixed. My plumber just comes and fixes it. But I do believe that he takes great pains to do it correctly. And so that's what I would just hope that audiences are aware of.
Absolutely. We all talked about being skeptical, and especially even for the health studies that you might be reading, because there's a possibility that they could be from a biased source or sponsored, or there's all these different things. So when it comes to reading the individual studies themselves, what are some tips people can do to confirm that the results and the data they're reading are valid, and that it's something we should be paying attention to? Sarah, I'll start with you again.
Well, there are a lot of things that people do need to pay attention to when reading studies, and journalists have to do this, but individual people can do it as well. And one of the biggest ones is to look at the sample size. So the smaller the sample size of people who were studied or instances that were studied, the greater the chance that it did actually occur because of chance and not because there was a true effect in the study. So thousands and thousands of people in a study would be much better than, a dozen people in a study. So that's one of the top things that people should look at. Who did the study is another good one. Was it by a recognized research center, and has it been published in a peer-reviewed journal? Would be another good thing to look at. Sometimes that gets into complicated issues of, is this a preprint or is this an open access journal? There are many, many different nuances that journalists are trained to look at when it comes to looking at the actual source of the study.
Yeah. Anna, what would you like to add?
Yeah, I think I always look for, and this is hard because COVID is a novel virus, but replication of if you find a study that says a thing, go find more studies and see what it found, what were its sample sizes. And like I said, that empiric method, it's like a wheel that's constantly churning. And so you're looking for how many times it can churn and create the same result. And so that's kind of a process. You can go down some rabbit holes there, but as much as you can find 2 or 3 other sources that had significant sample sizes from peer-reviewed journals, that's gonna give you more belief that information is credible.
And Natalie?
Yeah, I would say in addition to those things, looking at the population of who was in the study. So we used to have a phenomenon where it was usually mostly white men that were in a study. So for years, we knew really well what would work with white men in terms of medication and things like that. But we didn't know as well, there were some other differences for women and people of color. And so that's important. Another thing that I think we can sometimes help our loved ones and friends with is understanding the difference between a correlation and a causation. So a lot of times a scientist is first going to look and see if 2 things are related. So if one thing goes up, does the other thing go up too? That doesn't mean those 2 things one is causing the other. And this is kind of a critical thinking skill that is helpful for people to learn. And sometimes, I play this game, like, how would these things be related? And so one of the things that we used to think was that coffee had a lot of bad health effects. And people who drank coffee had higher blood pressure, for example. So later on, and that was replicated many times, but later on we found out that was actually related to a third factor, which was that people who drank coffee were more likely to be smokers. And so there were health problems that were related to that. And then there are like crazy things that you can come up with, like when ice cream sales go up, crime also goes up. That doesn't mean that eating ice cream causes people to go on a crime wave, right? It turns out that it's more related to hot weather and vacation. So burglaries kind of go up in the summer when people are out of their homes. So it's just a skill that's really helpful for people to develop when they're reading a study or evaluating an article about a study.
Absolutely. And Sebastian?
That coffee news is really good for journalists to know also that we can drink more than maybe we thought. I would say it's really important to check those studies' citations. So, a good reputable study will have a citation anytime it makes an assertion that's not specifically the focus of the study. So anytime they say, we know X is true, there'll be a little citation or maybe 2 or 3 backing up why they can say that. And so if that's missing, if there's a study that's just making assertions with no citations, that's a big warning sign. And then the other thing you can do, usually if you're looking at a study online on an academic resource, you can click on the names of the researchers at the top of the study and you can see what else they've worked on. You can also potentially Google their names to see, if they're at a reputable institution, if there's been interviews with them about their previous work, and you can kind of gauge, how reputable, how reliable the people who are doing that study are as well.
Great. Thank you all for sharing all those tips when it comes to identifying all different types of information and data. So I think we only have one last question, unless anyone wants to make any question or just submit any questions in the comments. But when it comes to COVID-19, we have all seen misinformation. I know a big part of my job doing social media here is answering a lot of those questions that people might hear out in the community, they're just not true for how we do things here in Boone County. But if you hear it multiple times from other people, it's hard to think that's not true. So what can someone do if they have a friend or family member that has shared a piece of misinformation? How should they handle that? And I keep starting with Sarah, but you're just right there. So in my little corner, so I'll go around.
Okay, well, the first thing to not do is to don't insult someone who shares information that you think is not correct. That's only going to make people more defensive and more likely to sort of dig in their heels. So it can be really hard, especially when these are personal relationships and friends and family. And it can be really hard for people to sort of change their minds about something because of that reason that I discussed earlier, that when you're identifying yourself as part of like a group and that group kind of holds certain beliefs or values, it can be very difficult to sort of open your mind to a different way of looking at things. But when it comes to science, health, and environmental issues, we do need to always remind ourselves to keep looking at the actual science. So there's some great sources that people can go to see if something is actually a myth that's been debunked, because there's actually a lot of myths that have been shared on the internet and get shared around social media. And two that I like to point people to, one is called Science Fact Check. So you go to factcheck.org/scicheck. And that's a really good one. So they'll take pieces of information that are out there, statements that politicians or public policy people make, or information that's circulating, and they will actually go into a great deal of research breaking down, going to the original sources of information to see if that thing is correct or not. And then they will go ahead and come up with a verdict of, what parts of this story are true and what parts are not. And believe it or not, there's a website called Snopes, SNOPES, that is also a really good one for debunking myths, and they have a lot of journalists working for them. So they do a great job of tracking things down and determining, based on actual original research, whether that stuff is true or not. So you might end up sharing that kind of information yourself on your own social media platform, but I wouldn't advise getting into like a fist fight with anybody.
No, we will never advise that. Anna, what are some tips you have?
Yeah, I totally echo what Sarah said of an outright "you're wrong" insult is never going to get you anywhere. And what I always consider is that I spent 2 years in the Peace Corps and did a lot of reading on development and mindset change. And in this book I read about bribery, in the introduction it said something just like so insightful, that the author said, to change your mind on this, you have to learn, and to learn is painful. And so when we are countering misinformation, we're asking people to be really vulnerable, and vulnerability is painful. And so as much as you can approach this from a standpoint of empathy, that is going to be more productive. And also understanding what makes misinformation and disinformation. Misinformation is information that is false information that is not intentionally spread. Disinformation is outright false information that is intentionally spread with the intention to misinform. So just make those really quick definitions. So the problem with misinformation, disinformation, it's often weaved together with factual information, and that's why it's so difficult to discern. An article might have a true statement right next to one that's outright false. And so just like keep these very empathetic, sympathetic things in mind. And then speak from a personal place of, yeah, I was really confused in April too. And like they said that we weren't supposed to wear masks, then we suddenly did, but this is the article that really changed my mind on that and made me think. And so aligning yourself, understanding that to learn is vulnerable, to learn is painful, but we're all somewhere on this arc, and trying to find people where they are instead of insulting them for being maybe farther behind you on this particular issue. Is going to be the most productive thing.
And speaking of masks, I mean, Natalie, you were saying earlier how you were out asking people about why they chose not to wear a mask and why they did. So if someone, let's say specifically about masks, is sharing that they're not helpful, how would someone approach that person?
So one thing we were talking about online, and I would say definitely if these people are your friends and family members, that means you have their phone number. You can call them or talk to them in person, and that's much more effective when we can see each other's eyes and develop empathy for one another. And one of the things that I noticed when I was interviewing people about the masks is that one of the questions I would ask them, so if they were really angry about wearing masks, I would first ask them if there was anybody that they loved that they were worried about getting coronavirus. And so they would stop and think and usually name that person because everybody has somebody who's high risk in their lives. And they softened a little bit when I asked them to think about that. So I think that's a really important way to try to break through. It's not perfect. None of these things are a silver bullet. And let's see. The other thing I was going to say is that try changing the format. This is not about coronavirus, but recently related to a hot controversial topic, I decided to try an experiment with my father, and he gets very different news sources and we have very different opinions. And so I called him and I said, I hope he doesn't mind me saying this, but I said, would you be willing to just listen to me for a couple of minutes? Because I know there are some things that you may be hearing that may be confusing, and I might be able to provide a little bit of insight on those. Would you be willing to listen to me for a couple minutes without talking? And then I'll listen to you for a couple of minutes without talking, and we'll go back and forth. And it worked. I have not tried the experiment again yet, but I'm going to. So it just takes a lot of compassion and patience, I think, to be able to get through to people, and of course, listening.
Absolutely. Is there anything you'd like to add, Sebastian?
Yeah, I mean, it's kind of building off of what people have been saying, but really trying to find common ground with people who you're trying to explain these things to is super important. And I've seen this play out a couple times in my Facebook feed where people post a study or something, and then one of their loved ones says like, well, this can't be true, you know, blah, blah, blah. You just want people to be scared, etc. And the people who posted the original, study reach out and say, it's like, hey, it's so good to hear from you. You know, I hope you're doing well. This is a really scary time for everyone. And, I know there's a lot of fear, but we're really like doing this. We're wearing masks, for example, because we want, you to be safe, and we want to be able to see you next summer when we come home or whatever. Just being able to find that common ground is super important, and really emphasizing it's like, yeah, I would love to, go hang out with my parents, or like go to a neighborhood barbecue, or like play a game of pickup soccer, which I haven't done in a year and it's killing me. I don't want to, be staying at home. I don't want to have to wear a mask. But I'm doing it because this is what science is saying will help us get to that point more quickly and protect people. So just making sure that you are communicating that it's also unpleasant for you and you wish that, this wasn't the case, but this is the reality, and acting like it's not isn't going to help anything. So just making sure that you find that common ground, and again, you're coming from a place of empathy, is going to be, I think, a lot more effective than just trying to tell someone that they're wrong or insulting them.
Absolutely. I'm so glad you brought that up because, yeah, we all have the same goal. At the end of the day, we want everyone we know and care about to be safe and healthy, and everyone in our community to live their fullest lives. And I know we are so eager naturally to get back to normal, but these things are ways to help us get back there sooner. So I really appreciate you all being here today. I don't think we have any questions from those watching, but there were a few comments of how beneficial this was. So you are all so appreciated for joining us. If anyone does watch this later and you have any questions, feel free to comment or message us, and I will do my best to reply to you. And if I don't know the answer, I will reach out to one of these fine folks who do. And in the meantime, I mean, is there anything that we haven't talked about that anyone wants to say before we end? No, we covered it all. No, okay. Well, thank you all so much. Again, I really appreciate it. And we will see you all again soon, I'm sure. Bye.
Thank you, everybody.
Thank you.